Hi, Wei here from Shift GPT, and today I want to talk about glute activation specifically to fix your tight hips. Now, I had some feedback recently regarding a post I made where I talked about the potential need to revisit your training programs and ensure a more well-rounded set of exercises so we don't have an over-dominance of your hip flexors. I also shared with you a hip mobility routine, which were a set of drills and dynamic stretches to help loosen off some of those muscles and just provide you a little bit of space around that hip complex. Now, we spend quite a lot of time in our lives sitting, be that at your desk or behind the wheel of a vehicle, and consequently promoting a shortened state within our hip flexors. What we'll then do is go to our workout and perform a squat or a lunge or a deadlift pattern, or do some running, or do some jumping or some kicking, and all of those things are very hip dominant exercises. Now, over a period of time, that can lead to lower back pain, hip or knee pain, which leads me to talk about glute activation and a process called reciprocal inhibition. Reciprocal inhibition is getting muscles on either sides of a joint to work more efficiently so as to take the strain off one side, and that whole joint can work more efficiently. So if we get our glutes to fire on our backsides, it will help then to take the pressure off our hip flexors and consequently cause a lengthening effect or a stretching effect through our hip flexors. Importantly, it also promotes strength on our glutes and helps us to maintain that balance across our hip joint. Now, our glutes are three muscles. We've got the glute max, which are the larger muscles on our backside. And then as you move around that hip joint, you come to the gluteus medius and our gluteus minimus. Now, very simplistically, the glute med and the glute min perform a local stabilizing function on the pelvis and the hips. What that does once they are switched on is that it will then free up the larger glutes to perform extension and the hip flexors obviously to perform that flexion function. Now, it's not as if our glute meds are not working at all, otherwise we wouldn't be able to function. We wouldn't be walking around, we wouldn't be doing the things that we need to do on a daily basis. But it's just that we haven't really connected that mind-muscle connection yet. It's almost like a dimmer switch where the light's down low, it's on, but it's not efficient. And what we're trying to do is really switch that muscle on to be more efficient. So what I've got for you are four exercises, which help to develop strength in that glute med and help to switch it on. What I want you to be mindful of is that the exercises are not there for you to load up with the weight as heavy as you possibly can and then smash that muscle. What we're trying to do is wake it up and develop the strength around it. So either use these exercises as a prehab before you go ahead and do something else. You could use it as a warm-up and then go for your run, so you have your posterior chain muscles switched on. Or you can start to interlace it into the body of your work, which is what I quite often do with my one-on-one clients who experience the knee pain, the hip pain, and the lower back pain. So they start developing that strength in those stabilizers, and they can then use that to be more functional. Have a go at the exercises, guys, and as usual, post any comments or any questions down below, and I will do my very best to answer and help you out. And in the meantime, guys, peace out. 4 exercises to help with our glute activation. First exercise is our static glute bridge with the feet hip width apart, the heels are down. We check our rib cage is down, abdominals are connected, glutes are contracted. Nice long plank position here, and we'll hold this position for about 30 seconds. Exercise number 2 is our glute bridge, a continuation from our static glute bridge. So we fold at the hip and then drive back up from the glutes, keeping those abdominals connected the whole time so there's no rib popping. We move from those hips, keeping our knees hip distance apart the whole time, and we avoid any excessive lumbar extension at the top of our movement. Anything between 15 to 20 repetitions here. Exercise number 3 is our cross-leg glute bridge. So we remain and keep that active core, and that single leg work now means we've got to bring greater work required to stabilize the pelvis. We're promoting lateral rotation on the hip of the crossed leg, and as we're moving here, we want to drive the heel of the supporting foot into the floor and really engage the abdominals and the glutes to drive your hips up towards the ceiling. The key here is to maintain a level position through your pelvis. So the temptation will be for the cross-legged hip to drop. So keep an eye on keeping those hips nice and level, and you're working somewhere between 15 and 20 repetitions on either side. Bit of a bonus here as we have a variation of our third exercise with the single leg bent glute bridge. So we're trying to maintain a 90-degree angle through that bent leg knee, and we're driving up from the hips. Key here is to ensure that we have the hips square and ensure that that floating leg remains stable at the hip. Hips again move together. And as we lower the hips down, we make sure that the hips land to the mat together, and we keep that core connected so there's no rib popping at any time. Again, we're always watching for any excessive lumbar extension. 15 to 20 repetitions on each side. Exercise 4 is our banded glute bridge with hip abduction. So that band can either be above the knee, as I'm showing here, or slightly below the knees. So in that glute bridge position, as you open up the hips, take care to not drop the hips. So we want to have control of those hips as we open and close the knees. So we maintain that glute bridge position and we control that band in and out, maintaining the tension through that band. The hips are up, the glutes remain contracted. And this lateral movement through our hips helps us to really target that glute med. Slower is better for this, and we're looking at somewhere between 15 and 20 repetitions.